All right, we are recording. Whoops. Um, this is video number 4 in our video assignment number 6. All right, so Miss Tuesday's put her on. We extubated, had her on nasal cannula, 2 liters, and she's starting to desat. 82% SpO2. So we got to go in and see if we can fix the problem. We got the whole team here: Dr. Slime, Nurse Joy, and myself. So describe additional acute changes I could witness performing my patient assessment. Um, on top of the increased work of breathing, you can definitely see accessory muscle use, altered mental state, just typical signs of distress, increased rate, respiratory rate, heart rate. Um, my ABG, I think, would be more hypoxic, hypercapnic. Um, even with her breathing more rapidly, it said that she's breathing shallow, so it's it's still not really effective, I think. So what kind of ABG do I expect? I would say, so if I did my ABG in her right radial, I would say pH is going to be decreased. I think it'd be, so for hers, I would say pH 7.30, CO2 of 75, that bicarb of 38, and then O2 is going to be 50. All right, and leading into that next question about, is it going to be acute vent failure superimposed on chronic vent failure, or acute alveolar hyperventilation superimposed on chronic respiratory failure? I think it's going to be the first one. I think this is a COPD patient, COPD ABG before we drew this one. And so now you're seeing this is an acute exacerbation. So with that, our chronic vent failure, which is our COPD baseline, having that acute exacerbation is going to lead to that acute vent failure superimposed on chronic vent failure. The pH is going to decrease. I think the CO2 is going to increase because of that shallow breathing. The your oxygen, I think our patient, she's consuming more oxygen than she's gaining, and I think by that, fatigue's gonna set in, and then that bicarb's trying to compensate. So this patient just doesn't have the mechanical reserve to meet that hypoxemic challenge. And like I said, I think that shallow breathing is going to increase the CO2 and decrease the pH. I just don't think our patient's strong enough to maintain that adequate ventilation effort. So I think that's where we're at with it. All right, so ran the blood gas on the I-stat, got back to the doctor. Dr. Slimes wants to initiate BiPAP therapy. So here's wheeled the V60 in the room. Daughter's still right there with mom, been there the whole time. And now we're gonna get into talking about the BiPAP and how I'm gonna fit her with a mask. So I'm gonna put her face in one of the see which measurement her from her nose and right above her chin. See how it lines up and best fit for her. And then say she's a medium. I'm gonna grab the medium mask. It's gonna have an M on it, and I'll hook that up to the circuit. Oh man. And then considerations for nasal versus a full face mask. I'm going to look at a few different things. Patient comfort. Is she a mouth breather? Skin integrity. Is she claustrophobic? But with her condition, this kind of acute episode, I'm gonna want to put her on face mask. So I might, and then I'll put some C-Flex down just so we can protect that skin integrity. And then my initial settings and alarms. We'll go with some basics, IPAP of 5, EPAP or IPAP of 10, EPAP of 5, put the FiO2 about 40%, rate of 14, I time of 1.00. Looking at my alarms. Like I said, my high pressure alarm is going to be 20. Low pressure alarms, inspiratory pressure is going to be 5. Apnea is going to be set at 20 seconds. My high rate is going to be at 35. My low rate is going to be at 8. And then my low minute ventilation is going to be set at 4. So that's my settings and alarms. And then describe how I will monitor effectiveness of her BiPAP therapy. Just going to do my patient assessment. Um, looking at respiratory status, respiratory rate, listen to her breath sounds, monitor her vital signs, making sure everything's looking good. SpO2 rate, tidal volume, the pressures, comfort, compliance. Also, probably get an ABG just so we can monitor that oxygenation ventilation status. And then just looking for improvement of her symptoms, like with that ABG, improving that gas exchange. So that's what we'll do while she's on BiPAP. Hopefully, her exacerbation and she improves, so we don't have to intubate her again. All right, that'll wrap up this video.